episode, I chatted with one of our newest members, Lindsey Reece. Before arriving in Sydney, Lindsay managed a broad portfolio of research and consultancy at Sheffield Hallam University's Centre for Sport and Exercise Science, focusing on the management of chronic disease through physical activity promotion, including cancer survivorship, neurological conditions, obesity prevention, and large-scale community physical activity and sport programs. She's worked closely with Public Health England and Sport England to implement their national physical activity strategies and has led numerous projects in partnership with Macmillan Cancer Care, British Lung Foundation, Parkrun, and local authority NHS agencies.
So I'm Dr. Lindsay Reece and I am based over at the University of Sydney and I actually lead a research group called Spreaker, which is a new research partnership between the New South Wales Government Office of Sport and the University, which is really exciting because it's one of our first flagship research partnerships where we're trying to inform policy and practice through research. So it's very exciting. All of the research that we conduct is around how we can get more people more physically active. And what's exciting around the new Spreaker partnership in our partnership with the New South Wales Government is all about how we can engage people through sport, recreation and physical activity. And the reason for that is physical activity, if it was a pill, we'd all probably be taking it. And we know that most of the population these days are not as active as they could be due to a whole wide variety of reasons. We've essentially ingrained physical activity out of our lives, so most people now are not physically active and they're not receiving the benefits for a wide range of their physical reasons or for their mental well-being. We also know that when you receive a cancer diagnosis, a lot of the time physical activity levels drop, and 60-70% of cancer patients aren't physically active to receive the benefits. Now that's really significant because not only can physical activity help in the prevention of cancer in the first place, it can also support the management of side effects of treatment.
How did you get into sort of like the relationship between physical activity and how that may help someone who's affected by cancer?
Essentially it was, so before I got involved with cancer, a lot of my research is focused on how we get most people into general physical activity and how we can get the population moving. And then before I moved to Sydney, I did a lot of work in England, and what that was looking at was how we can ingrain physical activity into chronic disease pathways. So it's how we can use physical activity as a management or a treatment of a whole wide range of conditions, and cancer was one of them. And also back in 2010 we'd had the review from the ACSM which had said that exercise is safe before, during and after treatment. Now the reason this is so critical is that we know most people in the population aren't physically active enough to get the health benefits, and that might be from a physical health benefit perspective, or it might even be for a quality of life and improved mood. But it's even more important when it comes to cancer, because not only can it help prevent cancer in its first instance, it can also help prevent help manage some of the side effects of treatment, which many people do struggle with, and it can also help manage fatigue, but also it can help people take control back of their lives. So it helps them improve mood, and it can help for a whole wide range. So it's right from physical to social and emotional benefits. And I guess the reason we were interested in the research is how we then support patients once they receive a diagnosis to then start thinking about how we build up physical activity once again. Because we know that once people receive a cancer diagnosis, physical activity levels drop. And that's quite critical, because we know most people aren't active anyway, and then if you receive a cancer diagnosis, that's only going to decline. And what we also know is that people need support to become more active and take those small steps to kind of getting more active in their daily life. Yeah. And it's that gap. That's what really fascinates me in my research, and is how we can support patients to put them at the heart of their care, and then support them to start moving more in a way that suits them, that they enjoy, that they feel supported, and how we can do that, use the best available evidence.
I imagine there's quite a lot of myths surrounding exercise when you're undergoing cancer treatment. So can you sort of outline some of the barriers for patients in overcoming, in really embracing exercise as part of their cancer treatment?
There are definitely a lot of myths, and I guess the one thing I would like to stress is there are a lot of myths in exercise anyway. Like most people just pick up a magazine or they look on their social media platform, and there's a whole range of the latest fad exercise, just like there is with diets. And I guess that is quite bombarding for the general population, let alone if you've received a cancer diagnosis and you're receiving all the different information, booklets and leaflets on what you can do next and how you manage your treatment. So the first thing I would like to stress is that whether you've had a cancer diagnosis or not, the physical activity guidelines are very similar. So what we recommend for the whole population is that we're trying to work up to achieving 150 minutes of moderate intensity physical activity each week. Now that can be in bouts of 10 minutes. So when I'm talking about physical activity, I'm talking about any movement that gets you a little bit out of breath, makes you feel a little bit warmer, and that could be anything from moving around the house, doing housework and gardening, right through to taking a walk to the shops, and then obviously your extreme end of being sporty or exercise. But it's really critical to say, to be active, you haven't got to go to the extreme sports. It can be absolutely anything that gets you a little bit out of breath. So that's the first myth I would really like to kind of to debust. And I think also once you have a cancer diagnosis, it's being mindful of listening to your body and thinking about how you respond to your treatment, and it's building it up gradually. The other myth I would like to debunk is actually whenever we start to understand what barriers there are for cancer patients to be active, for me it's critical that we actually ask them, that we engage them in the research process. And the study that we actually conducted in England, we spoke to many cancer patients and said, if you were going to receive support on receiving physical activity advice and how to become more active, what would it look like and who would you like to receive that from? And the main things that were coming out from patients and the main barriers were that most of it was a fear. It was either running around is going to spread my cancer, it was a fear that I'm going to feel worse. People wanted to hear it from a healthcare professional, so that clinical endorsement was really, really critical. And also people wanted to feel supported and safe when they did it. So safety and fear were the real two barriers from patients. And the way that we overcame that was kind of a little bit of education. So saying actually, when it's about building up gradually, it's listening to your body and doing it in a way that suits you. And it's also making sure that you access the right support. So it's talking to a healthcare professional and then having professionals that are trained so we know about it. So when we talk about leisure centres, fitness instructors, exercise physiologists, it's about them having the training and support, and that was really critical for patients. So they felt when they went to talk to somebody that they had not only an awareness of the physical activity advice, but it was also around their cancer and the red flags for them.
So just on that point about the knowledge that's required from health professionals, how do people get that knowledge and training in how to best assist someone with their exercise program when they're undertaking cancer treatment?
Tough question.
Are there any sort of like programs out there for people who might be interested in getting into this sort of space?
There are training programs. So drawing on some work that we did in England, there are training modules that fitness instructors can access. Here it's ESSA, so it's the Exercise Science, I'd have to find the acronym for that. So there are accredited bodies where they deliver structured training programs. But what we found by that when we started this journey back in England was that the training wasn't quite up to scratch. It was also quite specialist, so only certain healthcare professionals or only certain fitness instructors were going for it. So I think for me the training has to be twofold. There's an element of training for your fitness and physical activity professionals, but it's also training for clinicians on how to have the conversation, and that for me is the critical part. So after we'd spoken to patients about what they would like, what support they'd like to receive from physical activity, we then used that to design a pragmatic physical activity service, and that was called Active Every Day. And through that training program, we actually developed. So through that physical activity program, we actually then developed training for clinicians on how to have the conversation at each point of the pathway. And that was very much around conversation starters, when to have the conversation, what to listen to from patients. And a lot of the time it was the barriers, or it was the sometimes the struggles that patient was having as a way of overcoming was your window. And what I mean by that is if a patient was sitting there saying, I'm really struggling with my mood, or I'm struggling with fatigue, then it's the clinician's opportunity to say, are you aware that being physically active could actually help you manage that fatigue? And that was one way of starting the conversation. And then the other part of the programme was actually training fitness instructors. So we have a level 4 qualification in England, and it's different here, which I can kind of allude on shortly. The level 4 qualification is around a specialist exercise qualification for people with cancer, but it was also around just delivering community awareness, the red flags. So it's almost like what we want to do is make it easy for people to be active. As much as patients need the support, we don't want to put lots of red tape around where it's not needed. So yes, we'd had the specialist training at one end, but it was also around making people aware of the red flags, signs and symptoms, and where to go to if they needed some support. So the Active Everyday programme was a pragmatic citywide physical activity service. It started over 5 years ago, and it's now actually embedded in routine care from with the NHS. It was a small scale project, but it had so it's seen over 350 patients since it started. But critically, what it did was it provided a pathway from clinical care through to community. So it was around embedding physical activity at all points in the cancer journey, right from diagnosis to treatment. So at every point patients were talking about physical activity, were aware of where they could go to access support. Then if they wanted to, they could then actually receive a referral into a physical activity pathway. So the training was one element of it, which I've just described. Another element was actually delivering exercise with cancer patients, but it was making it free and it's making it accessible. So a lot of the time we work with existing providers. It wasn't about parachuting in and delivering a whole new structured 12-week exercise program in a controlled research environment. This was very much around delivering a service for cancer patients, and all the time they were providing input into how they would like to receive the messages, and we had a patient steering group, etc. And what was really exciting from that was it drew on the expertise of the patients themselves, but it helped us really understand how you apply the research guidelines. So in 2010 we'd had the ACSM guidelines that said exercise was safe. And I guess what's really exciting here in Australia is that we've just had the Clinical Oncology Society guidelines and their position statement, which once again reinforces in Australia that exercise is safe before, during and after treatment, which is really critical. And that should be a reassurance for patients as well. But what this statement is drawing on is saying that at every point of a cancer journey, physical activity should be embedded within routine care. And what's, again, a really exciting part of it is it's highlighting that you have exercise physiologists who have the appropriate training to give advice for patients around how to be more active, the steps they can take and where they can access support. And that for me is a real critical document here in Australia. Gives us an opportunity to provide some research within the New South Wales environment and beyond. And it's where some of our research now has started to really look at where it goes next. For me, what this document does is it gives us a really critical time to start looking at what research we can do. So one of the challenges that we have with research is how we then take this really well-evidenced, strong and robust document and actually apply it into practice. And for me, this is where the Active Everyday project did really well in England, because it actually started to work with partners and stakeholders in a city to work with how do we actually deliver this programme. And that's something that I think in New South Wales we're really keen to do here. And through the Catalyst Network has been critical for that, because we know that on paper this is all a great idea, but how do we actually in our day jobs when we've got clinicians sat in front of patients, how do we support them to have the conversation? As a patient, how can we make it easy for them to access support, pick up leaflets, see the messages and start becoming active themselves? And actually how do we use that to inform a service that's suitable for the climate here? And I mean that in terms of the context, the private system, the hospitals, how do we kind of link everything up? And that's why we're excited to start ICANN.
What is ICANN New South Wales?
So ICANN New South Wales is essentially drawing together a multidisciplinary research team to explore how we would deliver a pragmatic physical activity service for patients affected by cancer in New South Wales and beyond. To do that, what we're really keen to do is do a needs analysis, so actually understand, well, what advice is being given? Are clinicians routinely talking about physical activity? If they are, do we know what messages they are providing, where they access support, have they got any training needs? We're also really interested to understand from patients, is physical activity something they would like to receive advice on? If not, kind of explore that a little bit. Who they would like to hear the message from. Because I think here some of the learning was that the clinical endorsement is really key, but sometimes the clinicians are busy and they don't always think it's their place. They refer on to an exercise physiologist, but it's how do we integrate that into the kind of decision making. And I think from what we can understand from going through the process of developing the bid is that it's not that the advice isn't being given and it's not happening, it's just really patchy across the state. Some areas are doing it really well and exercise physiologists are embedded within multidisciplinary teams and they're making collaborative decisions on the patient care, and physical activity is there, they have a gym on site. Then some other areas there's very limited provision. So it's kind of how we get a consistent service for everyone in New South Wales. And then what we'd like to do is, so through that we'd like to interview clinicians to understand if we had a service like this, what would it look like and what would their part be? Talk to patients to explore their insights, and then together use those both to develop the pathway and then pilot it and see what outcomes we can explore. And when I talk about outcomes, the primary outcome would always be the physical activity levels, but critically it's looking at their physical and mental well-being as well. There was a grouping in Victoria, so Prue Cormy, who actually led the position statement. She leads a very large research group down there, and they deliver Ex-Med Cancer, which is a not-for-profit organisation, and they deliver physical activity and exercise within routine care. So there's quite a bit going on in Victoria in this space, but I think what's critical here is it's about, we can learn from all the pockets of research in other areas, but it's actually understanding how we can deliver it in this context.
Yeah.
Because I think that's very different.
And how you achieve widespread implementation so that, you know, you're not disadvantaged based on where you're receiving your cancer treatment.
Definitely. And also I think there's something around making it inclusive for all tumour sites. So we know in some types of cancer, physical activity is more routinely discussed than others. In England, what we learned through Active Every K was our highest referrals were from breast and prostate cancer. Mainly because it's more normalised. We have large-scale charities that kind of promote Race for Life type events, which are mass participation, one-off charity raising events. So it's a little bit more normalised to talk about activity, whereas in some of the more like severe cancers or based on the nature of treatment, sometimes it's not discussed. We actually had a story from a colleague I used to work with, she herself, who devoted a career to breast cancer and exercise and conducting research in that area. She herself got diagnosed with breast cancer, and as she went through her journey, it was really powerful because we put in the research bid for Active Every Day, and on the same day she started her treatment, and from that point forward she logged all the different contacts she had with clinicians, whether it was right from going to see a nurse and a clinical nurse specialist right through to seeing her oncologist to then seeing her chemo nurse. And only, I think it was over 35 appointments, only 2 people ever mentioned physical activity, and that was around her exercises post-surgery. And that for me was what really struck it home, that we read these documents, we see the research coming out more and more that exercise is so key, but it's actually how we apply it in day-to-day conversations is very different. And for me that's where you've got groups doing it, but it's actually what makes it realistic to achieve in New South Wales and within this infrastructure, and that for me is what's exciting.
Yeah, and I think it also has sort of translation beyond the cancer space, because I think, you know, you touched on it before, like everybody knows that exercise is important and exercise is good for you, but, you know, a lot of people have that conversation with their GP or health professional saying you should exercise more, but then it's how you actually make that part of your routine and part of your life, and how you motivate people and help people who maybe not naturally inclined to doing a lot of physical exercise.
That for me is why it's so important sometimes to highlight what we mean when we say physical activity and exercise, because a lot of the words people have negative associations with, they remember kind of being out on the court in their gym knickers freezing. Well, that's very much an England reference, but you have kind of memories of being active and it's not pleasant, you get hot and sweaty, it's not very nice, people are looking at me, people are judging me. We only need to look at some of the women in sport campaigns to see that the fear of judgment is so strong no matter what age you are. And that fear of judgment in terms of how you look or judgment in your ability. And I think for me that's why it's so critical to say when we talk about physical activity and exercise, it's about moving. Anything that gets you warm, whether that's put your favourite song on and dance in the kitchen, right through to gardening, being in your park with your kids, it's absolutely everything, and that's why it's so critical. And now these days it's the conscious choice to be active. Years and years ago it was much easier. We filtered it out of our environments, they're not conducive to being active, so it's a much bigger problem, and there's a whole range of work we're doing in New South Wales trying to get more people active through the sports sector, through the recreation sector, environments, transport, planning, health. There's no one solution to get everybody active, it has to be a team effort. Every sector has to come on board, and I think that's where you're completely right that it's not just in the cancer space that learning from this project can be applied. It can be applied in other chronic disease pathways, as well as helping just get everybody moving. That's what we want, everybody moving a little bit more often.
Yeah. I think especially considering you look at the rise of obesity and how projections that this will be the biggest health crisis in our generation, and how do you implement programs and pathways to help people understand the research that's out there and be able to translate that into their own life and take what works for them. You're right, you're bombarded with so much information about diet and exercise and what you should and shouldn't be doing that it's incredibly difficult to make informed, intelligent decisions on your own health without help.
I completely agree, and I think as much as we talk about the physical activity guidelines, actually what it's about is just avoiding not moving. So if you think about, and they're two very different things, but if we think about just avoiding sitting still for long periods of time, the biggest gains that we get from a public health perspective are going from nothing to doing something. So that's why I'd always say it's not a scary thing. And I think when people think about the whole extreme end of being sporty, oh, that's not me. And a lot of the images that we see on social media or we see in the paper, it's because people don't relate it to themselves. And it makes it very difficult, and that just lowers our self-esteem, which means you're not going to do it. What this is about is just thinking in yourself, well, what ways can I become more active in my daily life? Would it be getting off the bus a stop earlier? Is it parking the furthest away from the car park so I can walk with my shopping from the supermarket? It's those little things, and those little things will build up each day, and that will really make a big difference. So that would be my advice to anybody, is if you can do anything today, it's stand up and just have a little walk around, or even just stand up and jog on the spot, or walk on the spot, do a little a side step, anything. It's just doing anything that makes you fun, puts a smile on your face and just gets you moving.
Yeah.
If you haven't already had a cancer diagnosis and you're inactive, then you are at an increased risk of developing cancer and a whole range of other chronic diseases. And then once you have a diagnosis like cancer, then it helps with the management and further prevention, like for secondary occurrence. So it really is, and that's why we used the phrase in England several years ago, if you could bottle exercise up and put it as a pill, everyone would be taking it. But it's making sure we do it at the right level, and it's structured, and it's built into everyday life, and it's something that we do on a regular basis.
So do you think the healthcare system is doing enough to promote exercise as a form of treatment or in conjunction with treatment?
There is always more to be done. We have some great examples around the world where we look at integrating exercise within clinical care. The model we draw on is that GPs in primary care have been referring to 12-week exercise programs for a long time. Sadly, the evidence around whether they work or not has been quite limited based on a whole range of factors, because if you tell someone to do something or adhere to a program, they do it 12 weeks, and then as soon as that program ends, it's then about the maintenance of those longer term. But I think we're definitely in a world now where everybody is being encouraged to exercise. There's always more to be done. The training needs for professionals is also very key. So I know in England, GPs weren't routinely taught physical activity guidelines. And I always used to amaze me. I'd go to conferences, or I'd be in a room with GPs and ask who knows the physical activity guidelines, and only several would put their hands up. And also we've got a call to action for researchers and the community sector and other sectors to actually look at how we sell the offer. So you've got large community groups like Parkrun, who are rapidly growing as a free weekly 5k in local parks, trying to get more people active. Those huge, large global initiatives are there, and what we need to be doing is helping people get access to them. Not just a health problem. A lot of the time it sits within health because of the consequences normally kind of come back to the health sector, but actually it needs a whole cross-government approach, and that's what we're working hard. There's other areas of our research at Sydney Uni that are doing lots of work on that. My work with the sports sector is actually how we can engage sport to integrate public health within their system. So we've seen from New South Wales more and more kids and adults are actually choosing to get active in different ways. So lots of sports are starting to adapt their programs to engage new people, and that's something that we saw in England. So part of the Active Everyday program, we actually partnered with football clubs, and we developed a program called Fans Fighting Cancer. That was a modified version of football, so walking football. Walking football is a great way of tailoring the exercise for someone after treatment. It's better with the older age groups, not as aggressive tackles. It's sociable, fun. It's quite unique being in the football environment. Takes it out of lots of people kind of say you don't want to come to a clinical room and talk about it. So it's opportunities like that, and I think here we're at a really great time nationally. The Australian Sports Commission's is due to release later this year a national sports plan, and for the first time we think that will align with the health's physical activity guidelines, or we hope it will anyway. And that's starting to consider, because one of the pillars of the national sports plan is prevention through physical activity. So for me that starts to say that actually Australia is starting to think about sport and physical activity slightly differently. We're starting to get sector buy-in, and now it's actually how we deliver that. And programs that we'd hope through something like ICANN with cancer is actually supporting organisations or the sports sector to actually start to adapt their products that to help engage new people. And sports is like a great way. So like walking netball's just started, and walking netball's great. Like when you look at the outcomes, for example, if you've had breast cancer and you have surgery and you have reduced mobility on your one side, getting back in something like netball where you're with a group of people that have empathy, they understand what you've been through, they can talk about it, but actually you can go along and play and have fun and you're getting all the benefits of being active. It's fantastic. You can see a giant leap going, sport, netball, what role does that have in cancer and health? And it's actually trying to get that unique new partnerships together. And that's where I think when I talk about kind of partnerships and understand how it works in practice, is because you have to break down barriers of, would a nurse actually refer to a netball club, or would they think about it? And it's breaking down the myths of the sport kind of being competitive, and it's not actually about that so much anymore.
Yeah, it's about that social connection as well as the health benefits.
Oh, definitely. Yeah. We do lots of things because we enjoy them, and we keep doing activities because we enjoy them, we have fun, and we feel good. If you don't get any of those, then you won't go. And sport is a great way of fostering some of those communities. And what I'd like to do through this ICANN is engage sport in that conversation, because it's one way you can. And if we can pilot that and we can start getting some evidence and start developing some new partnerships, then who knows what will happen.
Do you have any plans to sort of do some engagement in rural and regional cancer centres?
We do. So one of the first elements of the ICANN bid actually is to scope out what provision there is. We have to be realistic with the resource available, but definitely, because we know that areas of disadvantage are, not only do they have limited access for treatments, but we also know for living in disadvantaged areas, then not only are you an increased risk for chronic disease, you're also more likely to be less active. So we know there are areas that we should prioritise, and this project is very much around engaging those as well. And the idea behind having a multidisciplinary team on the bid is that we can get a wide awareness of what's going on. We're not just based in the same centres as it always is. And we're seeing that across the board, because I think no matter which data set you look at, whether it's a sport-based data set, whether it's a physical activity-based data set, the social gradient is the undercurrent theme. It comes out time and time again, that if you live in a disadvantaged area, your risk of chronic disease is higher and you're less likely to be active. Those are the areas. Just like we need to focus on CAL communities, and we're doing a lot of work actually in women in sport, because we know that still women and girls is a priority area. So that's why for me, I think something like the ICANN is really exciting, because we can take little pieces of all our research and our links across government, with health, with the private sector, with physical activity experts, with sport, and actually start to kind of scope out and say, well, what care is there currently being delivered? Where are the gaps? And then engage patients and people to say, what would you like? And then combine the two and hopefully deliver a pragmatic service that has patient benefit.
Throughout the year, we will be discussing important issues in the cancer space, from the controversial to the common sense. Do you have a topic that you would like to discuss on a future podcast? Get in touch. We would love to chat with you. You can email us at sydneycatalyst@ctc.usit.edu.au. Catalysis is produced by Sydney Catalyst. The music is composed by Ling Zishun and distributed under a Creative Commons Attribution, Non-Commercial and Non-Derivative license.